project is Neotree, developed in Zimbabwe and Malawi to fight against infant mortality and decision-making support tools.
Our project is called Neotree, and our goal is to end preventable newborn mortality. Every year, 2.3 million babies die within the first 28 days of life. And of those 2.3 million babies, around 2/3 or 70% of those deaths could be prevented, not through providing really expensive equipment or drugs, but just through delivering the basic care at the right time and the right place for every baby. It's a digital tool, and it aims to deliver evidence-based care to every baby at the bedside, and also collect data, so information about each baby, about why they've been admitted to hospital and what treatment they've received, and also to guide the nurses and doctors at the bedside to make the right clinical decisions. There are 30 million small and vulnerable babies born every year and cared for in low resource settings, and so our mission is to catalyse the digital transformation of care for these babies. And our hope is that the Neotree, or interventions like the Neotree, will be used at the bedside for every one of those 30 million babies every year. And we also want to change the culture, or be part of the narrative that changes the culture for the use of these types of tools within health services, within low resource settings.
Voilà, Neotree.
Neotree, prize winner, Observatory of e-health in the southern countries, and Neotree, she's going to join us on stage, and we can give her a big round of applause. Give him, sorry. Please, Simbarache, come and join me. You're going to be given a mic. Simbarache Chimuya, well done for this prize, well done for this initiative from Neotree. We have some feedback now about what Neotree is doing on some part of the area you're addressing. Do you have a more general feedback for both countries on reduction of infantile mortality, but also capacity building of the e-health system, of the health system? Do you have any feedback?
Okay, thank
Just come next to me.
So our e-health system has been implemented at 2 hospitals in Zimbabwe and 3 more hospitals in Malawi, and also primary health care facilities. And at the moment, we are also increasing the number of healthcare facilities that will be using this digital platform. And we hope that by the end of next year, we should have increased to up to 17 healthcare facilities using this platform to care for newborn babies. We also have other benefits apart from just mortality reduction. I think things to do with rational prescribing, minimizing unnecessary antibiotic use in newborn babies where they're not quite indicated, because the platform is going to guide the healthcare practitioner on the bedside to choose the right decision where antibiotics are needed or they are not. And we also have deliberate efforts to train the healthcare workers on newborn care. And so we have reached to a number of healthcare practitioners, I can say more than 1,000 in these facilities where we are operating, who benefit from these educational programs and workshops and, refresher courses on newborn care. And that's another benefit which we bring through this platform. We also have, audits that we do because we now have data which is not easily available on newborn care. And this data is used to, assess how we are doing in terms of providing care, what are the major causes of morbidity on our units, what are the major causes of mortality, and we take deliberate actions to teach and train our healthcare practitioners, addressing those major issues. For example, I can tell you that we managed to cut down the number of babies being presenting with or admitted to our unit with hypothermia, because we realized there were a lot of gaps in preventing hypothermia within the unit itself. And so this data came out, and we saw the need to address such kind of challenges, and we deliberately started the educational program, how to prevent newborn hypothermia throughout our unit and also the maternity facility. So this resulted in a drop in the, proportion of babies who were coming to our unit for admission with hypothermia. It was really drastic drop. Yes.
Félicitations. Lorsque je vous écoute, Simba Raché, j'ai vraiment...
When I listen to you, well done. I feel that your system in Neotree, it's an application that gives a wonderful technical progress, because you need monitoring. It's very important for newborn babies. But then what I can see is the cultural progress, really, on the way you are taking into account new ideas that practitioners and GPs are changing their habits. Why not? What do you think about that?
Indeed, we would like to see a change of culture in the way the healthcare practitioners who look after newborn babies. And we not only want to see that happening or affecting people at, higher level institutions or central hospitals, but we know that there are a lot of babies who are cared for at the primary care facility level by nurses and other practitioners who may not have a sufficient training in newborn care. So the more facilities we reach out to, we know the more the number of newborn babies who would be cared for by well-trained practitioners at all levels. So this is our hope.
Vous allez recevoir là dans quelques instants, Bertrand, pendant...
You're going to get your prize. Thanks. Please stay with us here. Stay with us, Simarache. Thank you. Stay, because we're going to give you your prize. My last question. Pierre Fabre Foundation is giving you this award. It's not just a nice award on the desk. There's a whole support from the foundation to develop your project further. What are you expecting today from the teams of the foundation, Pierre Fabre Foundation? What are your expectations from the team?
Very much. Firstly, I must say we are really honored and really proud as research project to be visible and be seen by such institutions like Pierre Faber Foundation. I think we would like to be connected. We know there are a lot of other institutions out there who are doing various things, and it's an opportunity for networking and sharing notes and learning from others what other people are doing, which I think a foundation like yours is able to bring us together and make this networking. So I think going forward, it's one of the ways to really survive in this world with the support of other groups as well. I think there is a lot to learn, and I have a lot to learn from the groups that are here, which are doing fantastic work elsewhere. And I think we are going to, sharing notes, and there are a lot of things that I can adopt into our work as well. And I hope they also, a lot that they can adapt from our work into their work as well. So this is the beauty of having Pierre Faber Foundation bringing us together here. Thank you so much.
Quel très très beau message, hein, rassemblé sur...
It is a wonderful message, gathering, sharing good practices and going forward with the same aim. Bertrand Parmentier from the expert group from the E-Health, so we can give you the award immediately. Bertrand, please take a mic. Why did you choose from the expert group these Neotree? Why did you choose them? First of all, it's a platform that is open sourced, so really it's a big merit. Then it was really, we were very happy, and we love this project because there's a learning, spreading good practices and collection of data that was shared so that medicine could go forward with a dynamic that is centered on the patient. The second point was the speed of the scaling up. We are now working with 2 countries, with many hospitals, so this dimension of sharing that Simbarash said is operating as from now, and what is really remarkable, it is the heart of e-health, is that now we have tools that do not need lots of capital, and we have a wonderful leverage for public health policies that are addressed to everyone, and that is paramount in countries where people are very often isolated and extremely living in poverty. Bertrand Ducois, Neotree, please come. Simbarashi, come at the center of the stage for the photo. It is a price with 40,000 euros subsidy, and we hope it will help you scaling up more and carry on having all the successes that you have with Neotree. And thank you very much for sharing all your experience, because it is the aim of Odess is to do some network so that we can have feedback on e-health. Thank you very much, and well done again. Congratulations.
Voilà. Et l'ensemble.
And the whole of the team is here, a Neotree team. Thank you very much. Last award winner from this 2004 year. It's E-Heza in Rwanda. It's a digital platform for collecting patient data. Up to now, they were collected on paper, and here we have digitalized this data collection, so the analysis is much more precise, and we gain lots of time for the health practitioner. We can see that in the image. We need to improve data and analyzing of data collection and analysis.
E-Heza, it's an innovation of TIP Global Health. E-Heza, its Kinyarwanda name, means bright in future. It's a point of care.
Subtitles on the screens for translation. Thank you.
Care to support community health workers, nurses, to move to the journey of paper to digitalization. We had made sure that all their paperwork has been digitalized in a way that is comprehensive to simplify their workflows, the time they're spending doing different activities, but also in a simplified way that allow them to diagnose, treat, provide medication, as well as transfer across different levels of care, primary health care, but beyond. After collecting those informations, analyzing them was also another big challenge, especially for healthcare workers. So when you do this on paper-based, it can take months and months, but when you digitalize this in a way that is simplifying the flows, access to data in real time, data can support to tailor education to each patient based upon their specific needs. And on the other hand, that also as decision makers, not only for community health posts or health facility, to Ministry of Health as well, that we can use to do our regular decision, but in real time. It solves some of the biggest challenges or the problem they were facing at that moment.
Projet E-Heza lauréat.
Well done, wine prize winner for the E-Heza, Teophilia Orero, is going to join us to get this prize. Came from Rwanda. Well done. Teophilia, join us from Rwanda. Teophilia Orero Uwakuyo, near Toulouse at Pierre Fabre Foundation in Pierre Fabre. Are you moved?
Rwanda and all Africa, especially my team who are staying in Rwanda and beyond. We are excited to be in this platform and hope to build the network that will support all our work.
Ouais. On voit le travail formidable qu'on a vu en image que vous avez fait sur la...
We have seen the wonderful work you have done for digitalization data. Can you measure the impact of this digitalization for your for digital health?
The impact in how the digital platform can contribute to the improvement in health outcome. We have been also assessing how E-Heza is contributing to the reduction of malnutrition for children, having women accessing to NC activities, antenatal care activities, but also have been measuring how E-Heza is contributing to the quality of care being provided by healthcare workers, where we are assessing through a checklist how are they performing all activities without missing any activities. Because by missing HIV tests or by missing testing for anemia, you can have a child being affected by HIV. So through E-Heza, there is a way it does support you to improve the quality of care you are providing, but also how does digital platform contribute to the efficiency in terms of time, quality, and cost. Those are different ways we have been assessing our impact. So it has been reducing the time through the manual administrative activities, also giving the healthcare workers, nurses, and community health workers a way they can be able to generate a sufficient performance based on finance, based upon how they're using E-Heza. It is pushing them to cover everything, and also making sure that when through the evaluation, they have been focusing on every activities as per requirement for Ministry of Health.
Ce serait un système facile.
It would be an easy system to duplicate to other countries in the world.
E-Heza, we have been ensuring we are capturing all the flows, especially in Africa. You know, there are activities happening by individual, and then most of activities, they're also happening by groups. So you can conduct health assessment by group or by an individual context. And also it's offline and online platform. You know, in Africa, the internet is another challenge, but also it has been customized into different languages. Now it's in Kinyarwanda, Kirundi, and English. Soon we'll be translating E-Heza in Somali.
J'ai envie de vous poser la même question qu'à Simbaraché tout.
I want to ask you the same question as Simbaraché earlier. And of course, there's a financial help, but we're here in the foundation. We have a know-how, experience, expertise, I would say, to develop, that we have been developing over years on the e-health projects. What do you expect from us, from the foundation teams?
Expecting various support. We hope, since we are planning to scale our work, we have a vision of 10 years in 10 countries. So we hope we are going to build a network for people who will be more interested in E-Heza work. There are many partners here, whoever interested in having a full comprehensive primary care ecosystem app that support both community health workers and nurses in one application, not various applications. So please feel free to reach out. And also we'll be learning and also sharing all the lesson learned from different cohorts here. And through this platform, we hope also we'll be receiving some support from people, partners here on how we can strengthen our strategy for scale-up.
Profitez de l'expérience des autres. Et pour remettre ce prix, il va nous rejoindre tout de suite Béatrice Garrett.
Please enjoy Béatrice Garrett, who is a head of the Pierre Fabre Foundation, director. She's going to give you the prize in the name of a future foundation. The president, Manu Louvier, couldn't make it, so she asked me to be her voice here. So I'm going to say the Foundation for the Future, La Fondation de l'Avenir. It is a partner of the observatory that is supported by the mutualist movement. Its task is really to work with the whole of these French researchers in order to improve health practices. They started with surgery, and they have prizes with financing envelopes that go with it to develop new approaches, and now with all health disciplines. They're also working very hard on digital health, and they have joined us at the observatory because they thought that what's happening in South countries was really very good, instructive to try to find solutions in countries like France. Well, we also have to raise health challenges. So I'm very happy to give you this prize in the name of the Foundation for the Future, Fondation de l'Avenir, and in the name of the Pierre Fabre Foundation. Why did you choose E-Heza? I must say that E-Heza, let's say, they ticked all the boxes. They ticked all boxes. We have an expert committee, Bertrand Parmetier, Professor Barbele Yoko, and we have some criteria to choose the final stage after all the inquest, and in the final stages we have many criteria. You need to talk to vulnerable populations, have a medical service that is proven, to have seen the effects, to work in open source, in interoperability, to be linked with media authority. So all this. So we're talking to vulnerable population, to men and women. And I think what is remarkable is reinforcing capacity of agents. And in many countries, these people who are from the community who are trained to give first care and orientate family. They are very important link in the healthcare chain in many countries. They are recognized and they have been given a salary now, and they're here to support many NGOs initiatives. If they were not there, we couldn't deploy programs. So this building and reinforcing is very important. There's also a data use that is very smart. And what I loved was the real time. That is to say, to use data in real time, not just to make reports, but also to help decision making on the field. And this data was shared because it was built up with the healthcare authorities. So it's going to help the roadmaps of the health ministry to give a better priority and better means to the public health services. Thank you, Beatrice, with a photo. Thank you so much. Well done. Okay, well done for this prize that is going to go to Rwanda. To finish with, you stay with us, please, because we have. Please stay with us. We're here with the internautes as well. So please, from Lomé, you have questions to ask. From Uni, you've been with us live, Giscard, and all the people who are with you in this Uni. Do you have questions to ask to those prize winners?
Question? Sinon, moi, j'ai une question.
Allez-y, on vous écoute.
Quel conseil pourriez-vous nous donner pour la création d'un lieu similaire au Togo?
Pour la création...
What advice can you give to create a similar project in Togo? Both. What do you think? Teophilia, what do you think? How can you duplicate this project in Togo or somewhere else?
I think the most important is to first understand the challenge or the issue you are facing, especially you, the healthcare workers, and the entire ecosystem, like a government and whoever that you are trying to support. And also through that, it's really important that you co-design together to make sure that any solution or any digital platform you are bringing is solving those challenges. And also always make sure that you are in line within government system, but also you are using the tool that will be easily adaptable to your context. So if you are working with maternal child health, make sure that all the WHO protocols, Ministry of Health protocols are being followed, but also do you have internet issues? Make sure that your system can work on and offline. Are they going to use data not only for decision makers? We usually forgot healthcare workers, and yet they need those data to improve the quality of services they are providing. Thank you.
Simbaraché, je vous pose la même question.
Simbaraché, I'm putting the same question to you. Is there like basics that would be financial basis that is absolutely indispensable to be able to duplicate Neotree somewhere else? What do you think? What are the basics to duplicate Neotree in another country?
I think one of the crucial things is to work with the frontline healthcare workers in those institutions, in those settings, in developing the system, understanding where the gaps are, understanding what their needs are, So you develop it together. There is also another caveat where you need the policymakers, like the Ministry of Health. What does their policy, where does it stand regarding such kind of an innovation? So because this is going to be very important when it comes to scaling up in those settings, you need that ministry backup so that you can reach out to as many institutions as possible. So bridging those gaps and making that relationship with the Ministry of Health, who are the policy makers, when you want to introduce such kind of an intervention, I think that is very, very important. Thank you.
Merci. Il y a des micros qui vont circuler.
Thank you. We're going to give mics to the in Kinshasa. We have Yannick, and Yannick says that he's very excited to take part in this conference because it is a topic that is not really being accounted for in my country. Thank you very much, Yannick. Big hello to you. Other questions for all prize winners or any observations?
On apporte les micros. Assiatou.
So I'll go ahead and ask my question in English, and it's for Theophilia. Thank you so much for sharing all of this. It's such great things that you are doing with this innovation in Rwanda. My question is more so around scaling up. So you talked about scaling up to 10 additional countries or 10 more countries. I'm wondering what the criteria for that scaling up is. Is it based on the country's readiness, or are you taking other factors into account?
Thank you.
C'est bon.
Thank you so much. To scale our work, we are taking into different consideration. We are assessing the countries that are facing the same challenge as what we are facing. And then also we are making sure that we are meeting the countries which have a partner that can support us to scale. So, the partner who really understand the context, who have strong partnership with the government, who can support us through those navigations, but also can sustain the work through the implementation. On the other hand, we are also waiting for interest that may arise. So that's where also we can discuss and see how we can collaborate, because mostly we are focusing on the customization based upon different needs or different country contexts. But the key main focus has been focusing on the government needs, and then we find out how we can scale through the partners who can sustain the work.
D'autres, voilà, micro.
Merci. Florian Tréclin de la Fondation Terre des Hommes. On a parlé beaucoup
We talked a lot where we can see these projects are interoperable. The data collected can be integrated in the national health information systems. So my question is, are these data used by the government, by the health authorities? This data can be integrated, but is it used really, and how?
Our work with National Child Development Agency, where they reached out, they wanted us to support them to digitalize the child scorecard, where we'll be giving them different dashboard from the village, the lowest government level, up to the national level. The dashboard are customized based upon different needs, and through that also they are reporting according to what they were not able to manage. The village, they're reporting to the next level. The next level are also reporting to the government. They're not fully managing the entire issues. They are managing what they can be able to manage at their level, and then government or National Child Development Agency will use that opportunity to solve the challenges that were not solved at the district level, but also at the sector level. So that's another way of using and data. Another example is we have been working with the health centers and community health workers for they are all public institution or Ministry of Health staff, so they are also using data during their coordination meeting. At the health center level, their monthly coordination meeting, that's where they can use data to inform people. You have such indicators, you have a drop in malnutrition status, or you are having a severe malaria or severe anemia, what are you going to do next? And then they can report to the other level. Yeah. Thank you.
C'est-à-dire quelques questions, commentaires ou félicitations? Non.
Any questions, comments, or congratulations for our speakers? Madam, yes, that will be the last question.
E-Heza, and if I understand correctly, like in Rwanda, I'm assuming there are like various public health reporting requirements. Is there any consideration about any kind of public health reporting requirements on your platform, where the platform can satisfy that requirement, so that physicians don't have to use a separate system for tuberculosis, separate system for HIV, separate system for something for the requirement?
So thank you. Where E-Heza is being implemented, we have a comprehensive package. For example, for community health workers, all their package is fully digitalized. There's integrated community case management, there is nutrition, community-based programs, there are many more activities. They are full in one platform, and through that platform, they can refer to the health center, where also the full package will be there. So within one platform, you don't have to use a singular tool to diagnose HIV or to diagnose TB, because they are already in one platform.
Merci à tous les deux, on peut les applaudir une dernière.
Thank you both. A round of applause to both of you. Thank you very much.